Hello and hey there, welcome to our video presentation entitled The Role of Viruses in the Lung Adenocarcinoma. Without further ado, let's jump right into today's video. What is lung cancer? Lung cancer is a type of cancer that begins in the lungs. There are two main types of lung cancer, which are non-small cell lung cancer, NSCLC, and small cell lung cancer, SCLC. Non-small cell lung cancer is more common, accounting for about 85% of all lung cancer, while small cell lung cancer is often more aggressive and tends to spread rapidly. Non-small cell lung cancer originates in the epithelial cells of the lungs and can be divided into three subtypes, which are lung adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Lung adenocarcinoma is the most prevalent and usually develops in the outer region of the lungs and can spread to other organs. It is more frequently seen in women than men and in non-smokers than in smokers or people who are used to smoking. It is also more likely to strike in younger individuals than the elderly. Causes of lung adenocarcinoma. There are several factors that can cause lung adenocarcinoma development. For example, tobacco cigarette smoke, genetic factors, family history of lung cancer, exposure of radioactive gas, radon, occupational exposures, asbestos, aging and infectious agents. In this topic, we're going to focus on infectious agents, specific to viral infections, which are also highlighted to be an important cause of lung cancer, other than tobacco smoke. There are several viruses that has been mentioned to be involved in lung cancer, but in this video, we will just focus on these three viruses. So how can these viruses lead to lung adenocarcinoma development? Let's start with HPV. As a brief intro to the virus, HPV is a DNA virus, which consists of more than 100 types that infect mucosal membranes and skin. While HPV is traditionally associated with cervical and other head and neck cancers, its potential role in lung adenocarcinoma has emerged as a growing area of research. The most dangerous types are types 16 and 18, which causes cervical cancer in women. To date, there are three hypotheses regarding HPV infection and transmission into the lung tissue. The first hypothesis is that the HPV infection occurs in the reproductive system and then metastasizes through the bloodstream to the lung tissue. Another hypothesis is that HPV infection may be propagated either through oral-oral contact or genital-to-oral contact. The third hypothesis is that HPV may be transmitted as an airborne disease. Now let's get to know the mechanism. The genomic material of HPV contains genes that encode for E6 and E7 oncoproteins. E6 will interact with the tumor suppressor protein p53. In normal conditions, when there is DNA damage, a signaling pathway will be initiated that causes cell cycle arrest to repair the DNA. If it is unrepairable, the cell will then undergo apoptosis, hence no proliferation of damaged DNA. In HPV-infected individuals, E6 binds and degrades the tumor suppressor protein p53. Therefore, no apoptosis is triggered, and this causes the uncontrolled proliferation of potentially cancerous cells. For E7, it will interact with retinoblastoma protein, PRB, is responsible for the restriction point that assesses the DNA condition. In normal cell conditions, if the DNA has no damage, the PRB will release E2F, which activates E2F, and this signals that the cell can continue the cycle. If there is DNA damage present, the PRB will bind to E2F, which inactivates E2F, and this signals that the cell has to go for growth arrest and DNA repair before continuing the cell cycle. In HPV-infected individuals, E7 binds and inactivates the PRB. When PRB is dysfunctional, the E2F becomes active, leading to the proliferation of the damaged DNA, which can potentially be cancerous cells. It was reported that HPV E6 and E7 contribute in the overexpression of pro-angiogenic factors in adenocarcinomas, inducing the formation of cancer through angiogenesis. In smokers, E6 and E7 might synergize with carcinogens in tobacco smoke, potentially amplifying their mutagenic effect and accelerating tumor development. This is supported by research that shows 71% of all HPV-positive lung carcinoma patients are found to be smokers. Next, John Cunningham virus. JC virus is a double-stranded DNA and also a tumor virus in the family of polyomaviruses. It commonly infects individuals worldwide, but oftenly, they're asymptomatic until one's immune system is impaired, the virus will be activated. Furthermore, an association has been reported between lung cancer and John Cunningham, JC, virus infection. This virus can be acquired from inhalation of the virus. JCV may be involved in lung carcinogenesis, especially in tumor types other than adenocarcinoma, and this supported by studies that found 7 out of 13 patients, 53.8%, with lung adenocarcinoma had a positive PCR test for JCV. A report indicates that in humans, the lung expresses abundant levels of JCV receptor type sialic acids, alpha-2, 6-linked sialic acid in lung epithelial cells, which mediate JCV infection. This supports the hypothesis of the possibility of pulmonary epithelial cells transformation by JCV. There are 3 factors that JCV can cause tumorigenesis, but LT antigen is the major one. So how this factor can cause tumorigenesis? Let's talk about it. Prior to infection, this LT antigen will promote chronic inflammation, inducing genetic instability or interfering with major cellular signaling pathways, for example P53 and WNT signaling. In P53 signaling pathway, LT antigen will inactivate this signaling pathway and play a role in oncogenesis by inactivate tumor suppressor. Then, it leads to repression and release of P21WF1 and E2F, which contribute to uncontrolled cell proliferation and evasion of normal growth control mechanisms, which ultimately promoting tumorigenesis. In WNT signaling pathway, the LTH will deregulate or disrupt it, which contributes to the stabilization and accumulation of beta-catenin. Elevated beta-catenin levels lead to increased nuclear translocation and formation of a transcriptional complex with TCF-LEF factors. This complex enhances the expression of genes such as c-MYC and cyclin D1, promoting uncontrolled cell cycle progression and proliferation. Lastly, Merkel cell polyomavirus. Merkel cell polyomavirus is a small circular double-stranded DNA virus within the Polyomaviridae family, is primarily identified in the lung tumor tissues of non-smoking patients and can be transmitted through the respiratory route. So, how does the Merkel cell polyomavirus lead to lung adenocarcinoma? Merkel cell polyomavirus produces 2 viral antigens, which are the large T antigen and the small t antigen. Large T antigen is the most important viral oncoprotein, which plays an important role in the development of lung adenocarcinoma. The presence of the large T antigen DNA sequence is associated with epidermal growth factor receptor, EGFR mutations, which may enhance genetic susceptibility to lung adenocarcinoma. During normal cell growth, the epidermal growth factor receptor, EGFR, can be controlled to either be turned on or off, depending on the needs of the normal cell growth. The EGFR helps regulate cell growth and survival when it is turned on. Mutations in the EGFR gene lead to the EGFR protein being turned on too much, leading to uncontrolled proliferation that causes cancer formation. The most common EGFR mutations are EGFR exon 19 deletion and EGFR exon 2L 858R point mutations. Besides, large T antigen can also attach and sequester the retinoblastoma protein, RB, via the LXCCAC motif and block its activity, leading to uncontrolled cell proliferation. In conclusion, research in this area is ongoing, and the understanding of these viruses' potential impact on different cell types and their role in tumorigenesis continues to evolve. Therefore, more research is needed to understand the role of viruses in lung adenocarcinoma to improve the prevention, early detection and diagnosis, and the development of effective treatment strategies.